Chemoembolization is a method used to deliver chemotherapy medication directly to liver tumors, either primary tumors that originated in the liver or metastases that migrated to the liver from cancers at other sites. Even in cases where chemoembolization is not curative, this approach may relieve a patient's symptoms and extend survival. Doctors begin the procedure by inserting a catheter into a blood vessel in the patient's groin and advancing it into specific artery supplying the liver. The doctor then injects a contrast and visualizes the tumor and blood vessels on an X-ray to determine the condition of the portal vein and assesses blood supply to the tumor. The physician then injects an emulsion of anti-cancer drugs and microparticles through a catheter selectively placed into the artery feeding the tumor. The physician then injects an emulsion of anti-cancer drugs and microparticles through a catheter selectively placed into the artery feeding the tumor. This mixture keeps a high concentration of medication in contact with the tumor for a period of a time longer than that associated with traditional systemic chemotherapy. After the treatment is administered, the catheter is withdrawn and the patient can usually return home after an overnight stay in the hospital. Chemoembolization offers several advantages of traditional systemic chemotherapy, prolonging the time the medication stays in contact with the tumor up to as much as a month. This increases the treatment's effectiveness. Moreover, because the medication is delivered only to the tumor, rather than administered throughout the patient's bloodstream, healthy tissues are spared from side effects, allowing doctors to administer dosages that are up to 200 times greater than those used in conventional chemotherapy. The substances that are part of the injected mixture not only hold the medication in place, but also block the blood supply to the tumor, depriving it of oxygen and nutrition and thereby halting its growth. The substances that are part of the injected mixture not only hold the medication in place, but also block the blood supply to the tumor.